for Life is brought to you by Back in Motion Physical Therapy, Gothenburg Chiropractic Clinic, Mahabi Atwa Community Action Partnership, Natural Alternatives, and Lakeside Sports and Pain Clinic.
Hi, I'm Dr. Gothenburg, a chiropractor in Pelican Rapids, and I thought a really good topic today, just because of experiences in the last month in our clinic, is I would talk a little bit about pregnancy and perhaps touch on the subject that is there anything we can do when a baby is in a breech position? So to begin with, I want to absolutely say that I believe that chiropractic care is extremely important for both the mother and the baby throughout the pregnancy, and hopefully can prevent some of the ill effects, perhaps back labor, during the actual delivery. To understand this a little bit better, it's probably good to explain a little bit about anatomy. So across the front here we have the pubic bone. There are two different ligaments, a round ligament and a broad ligament that are in a sense attached to the uterus, the front side. And off of the front portion of the sacrum there is again a broad ligament that attaches directly to the uterus. So it's easy to see here that as the pregnancy develops, there could sometimes be a very obvious push and pull that affects not only the position of the sacrum, but also the alignment of the pelvis. There are other factors that can also amplify this push-pull effect on the sacrum and the pelvis. Certainly one would be, as the pregnancy develops, the uterus is being stretched. Maybe you've been told that your pregnancy requires bed rest. Prolonged bed rest would also be a contributing factor, as would your history prior to your pregnancy. Maybe you've been told that you have some degree of instability or a condition affecting the sacrum or pelvis. A way that I describe this to people is, think of a balloon that we've blown up, and here we have a ligament pulling in this direction and perhaps a ligament off the front of the sacrum. This creates a stretch or a torsion. I think it may affect the baby's free movement within the uterus, and it might be a contributing factor to a baby being or presenting itself in a breech pattern. One other factor would be hormonal, and this would be the hormone relaxin, which appears in the last semester. Its effect on ligaments would be to loosen the ligaments easily enough to allow the sacrum or the pelvis to shift or to become subluxated, which is a chiropractic word that means a minor misalignment. When we have a chance to help someone during their pregnancy, there are certain indicators that I look for that tell me a little bit about the position of the pelvis in respect to the sacrum. We're also interested if there's pain or tenderness. A lot of times we'll find a tautness or tightness in this ligament that is opposite of the side of pain in the lower back. In our example today, I'm using a set of blocks that will usually position in a manner that addresses the issue as far as the alignment between the sacrum and the ilium. There are other techniques that we can build off of this treatment that address a lot of the discomfort that someone may have in the front or allow a baby to go from a breech position to a more typical pattern for delivery. So I know I've covered a lot today, and you may have a lot of questions. If you have questions, please feel free to contact me. Again, I'm Dr. Gottenborg, Gottenborg Chiropractic Clinic in Pelican Rapids. Thank you.
Thank you for watching Wellness for Life. Brought to you by Back in Motion Physical Therapy, Gottenborg Chiropractic Clinic, Mahabi Ottawa Community Action Partnership, Natural Alternatives, and Lakeside Sports and Pain Clinic.